Ever wonder why your stomach hurts after you eat certain foods? Could it be gastritis? Today, we're embarking on a journey to unravel the mystery of gastritis. It's a common condition impacting countless individuals worldwide. Gastritis is essentially inflammation, irritation, or erosion of the stomach lining. It can occur suddenly or gradually, and its effects can be mild or severe. Understanding gastritis is crucial because it's not just about enduring the occasional stomachache. It's about knowing what's happening inside your body and recognizing when to seek help. Because let's face it, your health is your wealth. Gastritis can be a silent intruder, creeping in unnoticed until it's too late. But armed with knowledge, you can spot the signs early and take appropriate action. So if you've ever experienced persistent stomach pain or discomfort after meals, you might want to stick around. It might be more than just bad takeout. The tricky thing about gastritis is that it often sneaks up on you. Let's discuss some common symptoms. First up, we have abdominal pain. This isn't your run-of-the-mill stomachache. It's a persistent discomfort, almost a gnawing sensation in your upper belly. You might feel a burning sensation or even an ache that feels like hunger. Next, we have nausea. If you find yourself feeling nauseous more often than usual, it could be a symptom of gastritis. This is often accompanied by vomiting. Now, remember, occasional nausea can be normal, but if it's frequent and persistent, it could be a symptom of gastritis. This is often accompanied by vomiting. Now, remember, occasional nausea can be normal, but if it's frequent and persistent, red flag. Moving on, we have a symptom that might surprise you: loss of appetite. Gastritis can make you feel full after eating only a few bites. Now, who'd have thought that not wanting to eat your favorite food could be a cause for concern? Another symptom is bloating. If your abdomen often feels swollen or full, you might be dealing with gastritis. This is often accompanied by excessive gas, which can be quite uncomfortable. Heartburn is another common symptom. That's a burning sensation in your chest that generally happens after eating, and it's often mistaken for other conditions. If you're frequently reaching for antacids, gastritis could be the culprit. Lastly, let's talk about an unexpected symptom: black, tarry stools. This could mean that gastritis is causing bleeding in your stomach. This is a serious symptom and should definitely not be ignored. These symptoms can range from mild to severe, and they may come and go or persist over time. It's important to note that some people with gastritis may not experience any symptoms at all. So, if you've been experiencing any of these symptoms, it's crucial to consult with a medical professional. Remember, the sooner you address these issues, the better your chances are for a quick and smooth recovery. Gastritis isn't something to take lightly, but with the right care and attention, it can definitely be managed. Now that we know what to look out for, we should explore why gastritis happens in the first place. Gastritis, an inflammation, irritation, or erosion of the stomach lining, can occur suddenly or gradually. It's not a one-cause-fits-all situation. Various factors can lead to this condition. Let's take a deep dive into some of the most common causes. One of the primary villains in the story of gastritis is a bacterium called Helicobacter pylori, or H. pylori for short. This tiny organism lives in the mucus lining of your stomach and can lead to inflammation if it grows out of control. Most people with H. pylori in their systems don't develop gastritis, but it increases the risk, especially when other factors are at play. Moving on, long-term use of certain medications, particularly pain relievers like aspirin, ibuprofen, and naproxen, can also cause gastritis. These drugs, known as non-steroidal anti-inflammatory drugs or NSAIDs, can lead to inflammation and erosion of the stomach lining, especially when taken in high doses or for a prolonged period. Now let's talk about lifestyle choices. Excessive alcohol consumption is another significant cause of gastritis. Alcohol can irritate and erode your stomach lining, making your stomach more susceptible to digestive juices. Over time, heavy drinking can lead to inflammation and gastritis. Similarly, stress caused by severe injuries, surgeries, or critical illnesses can also result in gastritis. This type of gastritis, known as stress gastritis, typically occurs in people who are already critically ill. Finally, other less common causes include autoimmune disorders, where the body's immune system mistakenly attacks the stomach lining, and chronic bile reflux, when bile, a fluid made by your liver to digest fat, backs up into your stomach and esophagus. Knowing the causes helps us understand how we can prevent it or at least manage its impact on our lives. Keep in mind that understanding the cause is the first step towards effective treatment and prevention. In the next scene, we'll delve into how to manage gastritis. Stay tuned! So, we've identified the enemy and its tactics. Now it's time to fight back. Once you're diagnosed with gastritis, it's essential to adjust your lifestyle choices and diet to manage the condition effectively. Let's break down the ways to combat this condition. Firstly, the dietary changes. It's crucial to modify your eating habits to soothe your stomach. Instead of 3 large meals, opt for 5 to 6 smaller, more frequent meals throughout the day. This can prevent excessive acid production. Incorporating a lot of fresh fruits, vegetables, lean meats, and whole grains into your diet can work wonders. Also, staying well hydrated is a must. Certain foods can aggravate gastritis and should be avoided. These include spicy foods, fatty or fried foods, and processed goods. Beverages such as coffee, carbonated drinks, and alcohol can also worsen the condition, so it's better to limit or avoid them altogether. Now let's talk about medications. Over-the-counter antacids can help neutralize stomach acid and provide quick relief. However, for long-term management, your doctor might prescribe proton pump inhibitors or H2 blockers. These medications reduce acid production, giving your stomach lining a chance to heal. In addition to dietary changes and medications, lifestyle modifications play a significant role in managing gastritis. Regular physical activity can aid digestion and reduce stress, which is often a contributing factor to gastritis. And speaking of stress, adopting stress management techniques such as yoga, meditation, or deep breathing exercises can be highly beneficial. Finally, it's imperative to quit smoking and limit alcohol consumption. Both of these can irritate your stomach lining and exacerbate your symptoms. It's worth noting that while these strategies can help manage gastritis, they're not one-size-fits-all solutions. Each person's body responds differently, so it's essential to work closely with your healthcare provider to find the most effective approach for you. Remember, managing gastritis is a marathon, not a sprint. It requires consistent effort and patience. Before we sign off, let's quickly revisit the important points we've covered today. Gastritis, a condition characterized by inflammation, erosion, or infection of the stomach lining, presents symptoms like abdominal discomfort, nausea, and bloating. It's important to recognize these signs early for effective management. The causes of gastritis vary, ranging from certain medications, excessive alcohol consumption, to infections by bacteria such as H. pylori. Stress and certain autoimmune disorders can also trigger gastritis. Managing gastritis involves a combination of medication, lifestyle adjustments, and dietary changes. Anti-acid and antibiotic drugs are commonly used, while avoiding irritants like alcohol and spicy foods can bring relief. Including foods that soothe the stomach like fruits, vegetables, and lean proteins is beneficial. Knowledge is power, and with what you've learned today, you're better equipped to handle gastritis. Stay healthy and remember, your health is in your hands.
Thank you for watching. If you enjoyed this video, don't forget to hit the like button and subscribe to our channel for more informative content. See you soon.